Welcome to the People of Animal Health podcast. The host of our podcast is Stacy Purcell. Stacy is the leading executive recruiter for the animal health and veterinary industries. She's the founder of Therio Partners and the Vet Recruiter. Stacy has placed more professionals in key positions within the animal health and veterinary industries than any executive search professional. And along the way, Stacy has built relationships with some outstanding people who are doing incredible things to make a difference. The People of Animal Health podcast features industry leaders and trailblazers who have made a significant impact or are making an impact in the animal health and veterinary industries. Stacy chats with them to learn more about their lives, their careers, and the unique and interesting things that they have done to contribute to the animal health or veterinary industries. She is here to share their stories with you. Now here's the host of our podcast, Stacy Purcell.
Hello, everyone, and welcome to the People of Animal Health podcast. On today's show, we are talking with Dr. Linda Rhodes, who is a consultant working in the animal health industry for 30 years. Linda received her VMD from the University of Pennsylvania College of Veterinary Medicine and her PhD from Cornell University. After graduating from Penn Vet, she was a large animal practitioner for 5 years with a focus on dairy cows. She worked for Merck in human drug development and for Marielle as director of large animal development projects. She founded Alcara Bio, a contract research firm specializing in developing new drugs for animals. She then founded Aratana Therapeutics when the company went public. And in 2016, Dr. Rhodes was appointed to the board of directors for Zoetis. In 2017, she founded Feather in Her Cap, an organization dedicated to recognizing high-achieving women in the animal health industry. Welcome to the People of Animal Health podcast, and how are you, Linda?
Thank you, Stacy. I'm doing great. I really appreciate you doing this. I think it's a really great project.
Well, we're so excited to have you on today's show, Linda, and I know that you have had much success in your career, but I love to start off at the bottom in the very beginning of your career. Linda, what was your life growing up, and where did you grow up?
I grew up in Rochester, New York. My dad was going to Rochester Institute of Technology on the GI Bill back in the 50s, and he was interested in photography. So that Rochester, New York was where Kodak was, and that was the center of the world of photography. So that's where I grew up. And my father was a scientist. He ended up being an inventor, a person who really was interested in a lot of different things. But his research led him to do work on color and color photography, and he was a co-inventor of the color copier for Xerox back in the 60s. So I grew up in a house full of science and math and hard work, and my mother was a housewife, but she was also an artist. She did a lot of creative things, pottery and clothing and wall hangings, and so it was a house full of all kinds of things going on, but with a real emphasis on the joy of science.
Wow. That's fascinating. My dad was also a photographer. He used to take photographs out of airplanes. He served in the Air National Guard. Well, Linda, when did you first figure out what you wanted to do professionally?
Well, I majored in mathematics undergrad, and I was kind of a science snob. I was interested in math and physics and chemistry. But in 1970, when I graduated, was a real back to the land movement. And I had some friends who were living on a commune out in California. And they had a farm with goats and sheep and horses and chickens. And they invited me to come stay with them. And that stay really turned into 2 years of working on their farm and learning all about animals and just falling in love with being outside, working with animals, really kind of getting back to the roots of how people used to live. But I kind of got tired of being poor. So it occurred to me that I could be a veterinarian, and that would kind of combine my interest in animals with science, with being outdoors. That was back in 1971, 72. But the problem was I'd never taken any biology courses. So I had to go back and do my pre-vet. And I was fortunate enough to get into University of Pennsylvania back in 1974. So that was, launched me into the world of veterinary medicine.
Wow. And then how did you transition from that into the animal health industry?
Well, I was a dairy practitioner for about 5 years. I came, long, complicated story about how I got my first job. It was very hard to break into large animal medicine then as a woman. But I ended up in Ithaca, New York, and I just by chance was offered a very low-level instructor position at Cornell to teach bovine palpation. And when I was kind of hanging around the college, I made friends with a couple of faculty members, and they offered me a fellowship to do a PhD. And I was kind of tired of being in the barn, frankly, and ready for some new intellectual challenges. And so I took them up on it. And after I finished my PhD, I went straight into industry.
Wow. How many? I'm curious. How many women were in the field at that time?
Vanishingly few. I started my career at Merck on the human health side, but Merck had an ag vet group that was very close to exclusively men. I think there were some foundational women there that actually have seeded into the animal health industry. Susan Longhofer was there at the time, who's now, heading up the science and regulatory group at DECRA. Michelle Haven was hired there right out of her residency, and she is, ended up being on the executive team of Zoetis. So there were some women, but always at the very lowest of levels. And on the human health side, it was a little better, but still slim pickings for women.
Wow. Well, Linda, I know that you've had massive success in your career, but when do you feel like you were first beginning to gain traction with your career?
Honestly, it wasn't until I quit Big Pharma. I could not, the glass ceiling was just too thick for women in Big Pharma back then. That was in the early 90s, and I just hit the ceiling. And once I had a child and I was a mother and I wasn't going to be spending 100% of my time at work, I was really passed over. I was on the mommy track, basically. And it wasn't until I quit and started my own business that I began to feel like I was on the right track and that I could do something significant. And I was in my 50s by then.
I know that you've had some high points and also some low points throughout your career. Walk us through the highest high and also the lowest low of your career.
Well, that's kind of a hard choice. I mean, I think if you go back to the beginning, one of my proudest things, and people will laugh at this, is that I developed the ability to do very early pregnancy checks on cows. And I had spent years and years doing bovine palpation. It's a very hard skill to learn. I had gotten better and better at it. But when I got to the point where I could help the dairymen by doing very early pregnancy diagnosis, I was just really proud of it. And it seems kind of crazy now. But, I walked away from that world. And the true high point of my career was when I was appointed CEO of Aratana Therapeutics. That kind of brought together all of the different skills that I had perfected, except obviously palpation. and I was an entrepreneur. I had built and sold a business. I had been deep into drug development and became an expert in regulatory affairs. I had managed a large group of people as I grew my business, and the CEO position at Aratana was really a good fit for me. And I was very flattered and excited to be able to start that company with $25 million in venture capital, and me and one other guy, and a license to 2 really excellent drugs that finally made it to the market. As far as low point, I guess we already talked a little bit about that. It was when I really hit that glass ceiling and felt like I didn't know which way to go. And I was frustrated. I was angry. I knew I had more potential, but there was no way forward. And it felt like a brick wall. And I was very fortunate to have the ability to just walk away from that. Otherwise, I think I would have ended up a very bitter and unhappy professional.
Linda, what did you learn from that experience with hitting the glass ceiling? And then you talked about, that was also the time in your life when you had the most success, when you walked away. But what did you learn from that experience?
I think I really learned that there's so many different ways to succeed. And if you run into brick walls like that, it's fine to pivot. And I think a lot of people see success as just climbing the corporate ladder. And I think what I learned the most is it was just wonderful to be my own boss and to make my own decisions. And I think a lot of people looked at that as a failure. It wasn't clear that my business was going to succeed. I started out being a consultant, and people usually thought of when you quit big pharma and you called yourself a consultant, it just meant that you were looking for a job. But I was pretty serious about building that business, and it gave me great joy. I remember the first time I did a consulting job when I had quit, and I got a check in my mailbox. And it was just like this wonderful feeling of people are going to pay me for what I know and for my skills. And it was the first time that I really felt like I had something really valuable to offer. And that was just a wonderful feeling. So I think, taking risks, the ability to walk away from, a big paycheck and good benefits, but a dead end, that sometimes taking those risks can really vault you into a very different place.
I know that you've seen a lot of different things in your career. How have you seen the industry change over all of these years?
Well, it's funny. There's kind of been, I think, two big trends. One is the consolidation. We have fewer companies and bigger companies. But then in contrast to that, we have so many more startups. There's so much more energy to bring innovative ideas to the animal health industry. It used to be dominated as a kind of an ag industry. Back in the 90s, it was really cattle and poultry and pigs. The shift into companion animals has really blasted that wide open, and we're seeing all these amazingly creative startups in animal health, not only in the pet space, but in production animal too. So I see it as the big got bigger, but it spawned a whole bunch of really exciting startups that I think are gaining quite a bit of traction. So that's really new. Seeing the capital investment and the interest of private equity and venture in animal health is phenomenal.
What does your crystal ball say about the future of the industry? I mean, you just talked about, the mergers and acquisitions, and we've been seeing that. I'm wondering about the future, even with the consolidations, how much more consolidated can the industry get? But, what does your crystal ball say about that and also the future in general of the industry?
So I've been thinking about this question, and I actually think the biggest impact in the future is going to be artificial intelligence. I don't think it's coming fast. Many companies are trying to figure out what AI means for them, but I think it's going to be transformative to our industry. We're going to have AI programs reading x-rays. We already do. We're going to have AI programs diagnosing disease patterns, understanding the microbiome, impacting production animals in ways that we don't even imagine now. I really see that accelerating as a amazing and kind of intimidating change in the industry, because many of us are of an age when AI just wasn't part of the equation. So I see that coming, and I think it's coming fast. And I think the other big thing that's going to be happening, or is already happening, is this intersectionality between human health and animal health. There's more and more of an understanding that as I like to joke to my human medicine colleagues, dogs get cancer too. There's understanding that there's a lot of species learnings that can inform human medicine and vice versa. I think is just now really gaining traction, and that's going to have a really big impact. I mean, we saw it at Aratana when we took molecules from human health and brought them into animal health, and that was considered very unusual and difficult and not a smart thing to do initially. But now that we've paved the way for that, I think more human biotech companies are beginning to look at animal health and vice versa. So I see that intersectionality growing pretty dramatically over the next 10 to 15 years.
Wow. I mean, it's just, all that seems so futuristic years ago, and now that, the future is here. So, well, I'd love for you to share with our audience about the kinds of projects that you're up to right now.
Oh my gosh. Well, my favorite one is I'm writing a memoir of my years as a large animal veterinarian in Utah, where all my clients were Mormons. It's called The Lady Cow Vet, because that was my nickname when I was in Utah. And the manuscript is done, and I am in the process of working on getting that book published. So as part of that effort, I'm starting up a website that will be called ladycowvet.com, where I'm going to aggregate not only information about the memoir, but also stories of other women who were pioneers in large animal medicine, or who are right now struggling with issues of gender in large animal medicine. I'm going to put a bunch of history about women in the profession on the website. I'm going to have it be a discussion board for people who want to talk about women in large animal medicine. And I'm really looking forward to getting that set up. So stay tuned for that. And then I'm working on, what I think will be the next really transformative product in animal health. And it's being developed by a nonprofit group called the Michelson Found Animals Foundation. And it's a single injection sterilant for female cats, and hopefully also for female dogs, that will be the alternative to spay surgery. So a single injection in the clinic, no side effects, minimal side effects, and a lifetime sterilization. So that has been in the works. Dr. Michelson, who has funded this research, has spent almost $17 million over the past 10 years funding research for a non-surgical sterilant. We finally found something that we think is going to work, and I'm volunteering to help bring that through regulatory approval. So that's stay tuned. I know it sounds like a pipe dream, but it's coming.
That will be truly transformative. And Linda, I also would love for you to talk about the feather in her cap, because I know that has been something that you have started with some other high-profile women in the industry. I know that's dear to your heart, and I know that I've been a part of that too. So I'd love for you to talk about that. What gave you the inspiration? Why did you start it? Tell us more about Feather in Her Cap, if you will.
Yeah, thank you, Stacy, and thank you for being an early supporter of the organization. It actually came out of my frustration with the Iron Paw Award. As much as I love Kansas, and I was happy to start Aratana in Kansas, every year when another man would get the Iron Paw Award, I would think about all the deserving women who really should be considered for the award, and yet year after year after year, that didn't happen. So I just had this kind of bug in my head about it, and I went to a veterinary meeting, and I gathered a bunch of my women friends and said, I've got this crazy idea to do an award just for women, high achieving women in the animal health industry. What do you guys think? And I was prepared for a little kind of pushback, but everybody liked the idea. And we just literally made the board of directors from that group, and got a tremendous amount of help from the industry. From Zoetis was an early supporter, Boehringer, Elanco, all stepped up, because I think it was time for this to be a reality. And we did our first award ceremony, and there was 28 nominees. I mean, it was just amazing, the number of high achieving women that should be recognized. And we couldn't just choose one. So the first year we had four awards that we gave out, and we had a sold out dinner event, and people had a great time. And the rest is history. We've done 4 years worth of awards, and my funnest fact is that the year after we started Feather and gave an award, Kim Allen, who had been the president of Henry Schein and was really well deserving, and we had given the award to her, won the Iron Paw Award the next year. And then the year after that, I won the Iron Paw Award. So
I was going to say that's come full circle because you did win the Iron Paw Award.
And one of the things that I had always wanted to do was if and when I won the Iron Paw Award, to put up a montage of all the deserving women. And so that's what I did. And I just said, this is not just me. This is standing on the backs of, a whole group of really underappreciated women leaders in animal health. And I was very happy to do that. And then I asked women who'd been in the industry for more than 5 years to stand up at the event. There were like 1,000 people there. And all these women stood up, and I said, these are your future leaders. Get to know them. And I think we've made a difference. I think that there's now much more acknowledgement about the gender issues in our industry, and things are changing.
Yeah, and you've been a big part of that. And I remember I was at that event. I heard you say that, and I remember looking around and seeing all of the women in the industry that are making and have made an impact. So thank you for that, and it's so good to see the Feather in Her Cap getting such good support. I can't wait to see who the nominees are for next year.
Yeah, and I would urge everybody to nominate. You can nominate anytime during the year. All the information about it is on the Feather in Her Cap website. And if you know of a woman that's 10 years in the industry, a significant accomplishment that you can point to, and some history of mentoring other people, they qualify, and we'd love to have them. So, go to the website and nominate. There's lots of well-deserved people out there.
Yes, I hope all of our listeners will go to the Feather in Her Cap website and nominate a woman or several women that you know that are deserving. Linda, successful people are typically proactive people that are very organized. I'd love to hear how you typically organize the first few hours of your day. What time do you typically wake up, and what is your morning routine like?
Well, I am the great good fortune to be retired, so I don't have to set an alarm clock anymore. but I do wake up pretty early because I have an old arthritic cat that wants breakfast, so she's my alarm clock. But I start slow in the morning. I like to read. I like to read a lot, and I usually grab a cup of coffee and sit down in an armchair in my library and do at least a half an hour, 45 minutes of reading, whether it's the New Yorker or I read a lot of nonfiction. Right now I'm reading Obama's first book that he wrote called Dreams of My Father, which is just a fantastic book. But I start out slow. I start out reading. And then, one of the key things for me is I need to get some exercise every day. So I either walk, or I get on my Peloton, or I do push-ups, or whatever I need to do. I kind of take inspiration from Ruth Bader Ginsburg, who was a big exerciser. But the other thing that I've done recently is I have tried to restrict Monday and Tuesday as being the days that I work on consulting or my drug development projects, or phone calls, or any kind of professional related stuff. And then I have Wednesday through the rest of the week to have a blank calendar. And that way that gives me space for my writing. And that was really critical for me to be able to finish my memoir. And now I'm starting to work on the sequel. So I want to have those big empty spots in my calendar now. And I've tried to make that happen.
Wow, you're going to have a sequel too. So I can't wait to read your first book, and then that's good to know there's a sequel coming. So you mentioned some of your daily habits: exercise. You like to read. What are some other daily habits that you believe have allowed you to achieve success throughout your career?
Well, I don't. That's kind of a hard one. When you're in the middle of your daily habits, it's kind of hard to point to what exactly they are. I I try to get outside every day. I live in a beautiful place in New Hampshire. I have 17 acres of woods. I like to just go out and watch the birds and wander around and see what's blossoming in the garden and pull some weeds. And I have a big vegetable garden. Um, but I'm a pretty organized person, and I sit at my computer at least an hour or two a day, responding to emails, thinking about projects, doing my board work. But I try not to sit down too much. I get up, I walk around. I don't think it's healthy to be sitting at the computer for hours every day. Um, and then I think the other important thing that I try to do almost on a daily basis is check in with a friend. I live by myself. I don't feel lonely, but I really feel like it's important to stay in contact with my network. And I just have such a great supportive network of friends and colleagues all over the world, that I try to make a check-in, at least with one person, often with somebody I haven't talked to in a long time, every day. And that's just wonderful, because I learn all kinds of new things and I plug into what people are doing. And um, it gives me a way to connect people. I have a lot of people who are asking me about jobs and about contacts and about fundraising, and it gives me great joy to connect my friends to opportunities. So that's a fun part of my day.
Hmm. Well, I think it's so important, especially in these times we've been living in. It's important to stay to get connected. I'm curious about mentorship, because I know that you are a mentor to many in the industry, but I'm curious what mentor has made the biggest impact on your career?
Well, I've been thinking about this question, and I have to say that I really never had the benefit of a formal mentor. Um, I had connections with people that helped me on individual things, but I never really was able to develop a real mentoring relationship. And this was because I think the majority of my career happened before mentoring was really much of a thing. I'd say my father, because he was in industry and he taught me a lot, and he was a real, he was an inspiration to me. Um, I'll give you one example. I had a connection with a woman at Merck on the human health side. Her name was Dr. Liz Stoner. She was head of the whole clinical trials group at Merck. And I first met her as she was head of a project team, and she was the one who helped me through the initial craziness of balancing motherhood and work, because she had two kids. She was maybe 5 years older than me. And she just gave me a lot of really good advice about how to deal with working full time and having an infant. Um, and fast forward years later, Liz ended up being a managing partner at MPM Capital, which was the venture capital group that had the idea for Aratana. And when they were looking for a CEO, Liz thought, oh, I know a veterinarian. And she connected them with me. So even though we didn't have a mentoring relationship throughout my entire career, at a couple of key moments, she was there for me. So I guess I would choose Liz Stoner.
Wow, that's a wonderful story. And that's why it's so important to, to maintain those relationships throughout your career. Linda, what advice would you give the younger version of yourself?
Well, speaking about this motherhood thing, I do give this advice a lot to young women professionals. Don't wait. It's really great to be a mom. It was one of the best things I ever did. I didn't have my son until I was 42. I used to joke that if I'd known how wonderful it was to be a mother, I probably would have had 10 kids. Um, but I was very happy to have one healthy, wonderful, young son who's now 30. But I think a lot of women struggle on, if they want to be successful in their career, they focus on their career and they think, oh, well, later on I can be a mom. And I tell them, don't wait. There's never a good time. It's always challenging to balance motherhood and work. And you want to be young because it takes a lot of energy. So, and I guess the other thing I would say is that focus more in your working world on relationships. I had the attitude, as I think most young women do, of if I just put my nose down and I did a really good job and I worked hard, my good work would be recognized and I would get ahead. And that's just not the case. And I did not understand that building relationships at work was more important than the actual work. So that's the advice I give young women. Don't forget to step away from your desk and go out to lunch with somebody, to connect with somebody who's your superior, who can help you in some way, to build your social network, because a lot of what happens in your career is going to rely on people liking you and people wanting to spend time with you, and not so much looking at the fact that you've created this great work product, but you sat at your desk for a year and didn't talk to anybody. So don't just put your nose down. Reach out, meet other people.
That's really good advice. And going back to what you said about motherhood, I think so many women think you can't do both, and you're an example of how you can do both. You can have a successful career and be a mother. And I like what you said about don't wait.
Well, you're an example too, Stacey. You have a successful career and you're a mother, so you must have found a way to balance it as well.
Well, what you said about there's never a good time. I've said that too. There's never a good time to have a family. There's never a good time to get married. There's never a good time to have kids. But like you said, don't wait. So I had the same philosophy. One of the things that we notice with successful people is that they tend to have idiosyncrasies that are actually their superpowers. Linda, I'm curious, what idiosyncrasy do you have?
Well, that's a hard question. I guess, I don't know if you'd call this an idiosyncrasy, but I don't get embarrassed asking what might be stupid questions. I'm the one in the room who's always willing to say, I don't get it, or I don't understand, or this doesn't make sense to me. And in many big professional meetings, I remember sitting at the Merck R&D, annual review of research. Everybody tried to pretend that they understood everything. And I just never did. I would just say, that's not clear to me. I don't get that. And maybe that was one of the reasons I didn't get promoted at Merck. But I think an idiosyncrasy that I have is I'm willing to show that I don't know something and that I don't understand something, even if it might make me look stupid. And I think that's, some people might think that's a weakness. I find it a strength.
No, and it served you well. What is a message or principle that you wish you could teach everyone?
As kind of stepping outside of the professional realm, certainly right now, I think we all see the need for this. I would want to teach people to cultivate compassion. We often forget about this in our professional life. So many people have so many things going on in their lives. They have, they're suffering from an illness. They have a spouse that's suffering from an illness. They're going through a divorce. They're having problems with they have an autistic kid. There's so many people that have issues and problems outside of work that we're not aware of. So, I would just urge people to focus on compassion. Be kind. Be kind to everyone, because you don't know what people are going through. And especially now in the time of the pandemic and all the challenges that we're facing. I think I think I've learned over the years that kindness is probably the most important thing that we can offer to other people. And I try to practice that even in the most difficult situations. But I guess that would be the message that I would like to send to people is take a deep breath when you're feeling angry, your colleague has let you down, your boss is asking you to do too much, you're feeling passed over, you're upset about something. Just take a step back and try to be compassionate.
Yeah, that's such good advice because, like you said, so many people, most people are going through something, and they often don't bring that to work to talk about it at work. So you never know what somebody might be going through at home behind the scenes. So that's very good advice. Linda, some successful people say that they've had a key book that they've read that really helped them to change their mindset and their approach to success. Do you have a key book that has impacted you the most? I'd love to hear that story.
Well, that's also a very hard question. I mean, when I was very young, I read Tolstoy's War and Peace, and it's a sweeping novel about humanity. And I didn't really understand it then, but I understood that there were patterns in history that we could learn from. And I've gone back to that book 3 or 4 times. It's an intimidating book. It's a huge book. It has like a gazillion characters. But it's just fabulous. And when I read it a second time, I had a completely different view of what it was saying. And when I read it a third time, actually fairly recently, it just seemed like an allegory for our time. So I think that I would point to that book as kind of the big picture book that I learned a lot from. The whole idea that things that we're going through now are things that humans have gone through throughout history. We're not unique. These problems have been there, and we just have to recapitulate them, and we can learn from looking at what happened in history. But in terms of a professional book that just hit me straight between the eyes is a book called Power. I don't know if you've heard of it. It's called 48. Let me look. I wrote it down here so I wouldn't forget. It's called 48 Laws of Power, and it's by a man named Robert Greene. And that was the book that helped me understand the power dynamics in my professional life. And I guess I could summarize it by saying that before I read that book, I was playing Scrabble at work, and I was playing the game, the work game, which in my head was kind of Scrabble, and I wasn't succeeding. I was failing. And then after I read that book, I realized, oh, I was playing Scrabble, but everybody else was playing Monopoly. So I couldn't possibly win at work because I wasn't even playing the same game. And that book on power gives examples of power dynamics in a number of different, and all throughout history. And it just woke me up. And I realized, oh my gosh, I wasn't playing the game I needed to play to be successful.
I have not read that book, but I'm gonna get that book. That sounds very interesting.
I highly recommend it.
Well, Linda, yes, thank you for sharing that with our audience. Linda, you've got the mic. What is one thing that you'd like to share with our listeners of the People of Animal Health podcast before you drop the mic today?
Well, thanks for giving me the opportunity to talk with you about these lessons learned. I have had a long and varied career. I guess I would like to say 2 things. The first is that when you start out in your career, you never know what twists and turns it's going to take. If somebody had told me when I was out, doing those 30-day pregnancy checks on cows in Utah, that eventually I'd be the CEO of an animal health startup company that was going to do an IPO, I would have said you were crazy. So I think our ability to be flexible and to seize new opportunities as they come up, and to not just say, well, this is what I learned and this is what I'm going to be for the rest of my life, is so important. And being willing to take those kinds of risks and and just be creative about your career, I think is just so critical. And then I think that's really the last and probably most important thing is that there's more to life than work, that we all focus on our professional success. We're ambitious, we're hardworking, um, but it's just so critical to take time to enjoy your kids. They grow up very fast, to enjoy nature, to enjoy your friendships. Because I have a little thing on my wall here that says, the trouble is you think you have time. And it really kind of highlights my philosophy of, you never know how much time you have. And if you postpone all the fun stuff and all the family stuff and all the things that give you joy until you have a certain level of success in your work, you may be very disappointed. So don't wait. Make a balance. It'll pay off.
Well, that's such good advice, because so many people, I think, they think someday I'll do this, or someday I'll do that when I hit this goal or when I achieve that level of success. So what you're saying is to enjoy every day, enjoy the time, and don't wait. That's such good advice, and what a good note to leave our listeners with today. Linda, thank you so much for joining us. We enjoyed having you on our show and sharing your career with us and all of your wisdom and the history as you've been in the animal health industry. I really enjoyed having you as our guest today, Linda. Thank you so much.
Thank you so much for having me, Stacy. It was a pleasure.